Good morning. There are many questions about the vaccine and its availability, and that's understandable. The rollout from the federal government was slow, and Missouri is at the back of the pack in getting vaccines to jurisdictions like St. Louis County so that we can put into action the large vaccination sites we've been planning for months. This week and last week, we received no vaccine from the state, and it's unclear when our next shipment will come. This makes it difficult for our public health officials to plan. Hospitals are now the primary receiver of doses from the state, and we appreciate the work of our healthcare partners and all that they are doing to get folks vaccinated. We also know that as the number of available doses increases, so will the need for us to step up our operations. The Department of Public Health so far has received 2 shipments from the state, providing 5,339 doses that we completed yesterday. Also yesterday, we received 3,900 doses of the Pfizer vaccine from one of our local hospital partners. These doses will allow us to open this morning our large-scale vaccination site at St. Louis Community College Forest Valley campus in Ferguson. On Thursday, we'll begin offering shots at 3 county fire districts, Afton, Eureka, and Melville. At each of these sites, including the John C. Murphy Health Center in Berkeley, appointments are required. And those who get the appointments who have pre-registered with the Department of Public Health will be notified when it's time to receive a shot based on eligibility tiers determined by the state. The interest is high, with 260,000 people on the County Health Department's pre-registration list. So we ask for your patience. Many people are eligible, but too few shots are available. Our Department of Public Health has begun sending emails to residents and letting them know about the high demand. And the email confirming your pre-registration says in part, when the vaccine is available and it's your turn under state and federal guidelines, you'll receive an email inviting you to make a vaccine appointment. For now, feel free to register and to receive your COVID-19 vaccine elsewhere. If another opportunity to receive a vaccine arises before we can offer you an appointment, please accept it. However, please do not make appointments to be vaccinated with more than one entity. Doing so might deny someone else a chance to get the vaccine. Each week, we'll provide an email update concerning the vaccine status in St. Louis County. And in the meantime, please visit stlcorona.com for up-to-date information on COVID-19 and the vaccine. This is a new frontier for all of us, and I'm proud of our health department for the work in setting up a system ready to be quickly built out to support an increase in the vaccine. The state has not given us any funds to help with the vaccine rollout, and something county council members have rightly raised as troublesome. Council Chairwoman Lisa Clancy and other council members plan to ask the state health director to come to an upcoming council meeting to talk about the release of state funding for vaccine rollout. While we wait on state funds, we have leaned on CARES funding we received last year and have tapped into our health department budget to provide staffing and supplies. This will ensure there is no delay in getting vaccines into the arms as quickly as we have doses in hand. But this has been a long journey, and it is far from over. Vaccinations signal an end to the pandemic. Until we have widespread availability of the vaccine, please continue following the public health protocols that are keeping the pandemic from getting even worse. The protocols are working, and we hope that we can relax these restrictions soon. When we do it, it will be gradual, and it will be thoughtful, and it will be with the advice of our public health experts, the pandemic task force, and the business advisory groups that have helped us shape our path forward. Thank you, and I'd be glad to answer any questions.
Dr. Page, we have a few questions that came in from Channel 5. To the county's knowledge, where are the doses that were promised by the state?
So the question is about where the vaccine doses are that have been promised by the state. We haven't been promised doses. What happens is we order doses, our health department orders doses through the state determines our allotment, and then those doses are shipped directly from Pfizer. We order what we think we can use based on advice and recommendations from the state about what might be available, and then we wait and see if those shipments come.
What is the plan to hold the state accountable for not following through with these shipments?
Well, we order and we ask for what's available. The state has told us that they are making their determinations on vaccine allotment based on limited supplies and based on the population. And we are expecting to receive our fair share of vaccines on those doses based on what the state has available and based on our population in St. Louis County. We will continue to have these conversations with the state health department. Our St. Louis County Health Department is in constant daily contact with the leadership of the state.
And why does it seem like rural areas are the priority for vaccine shipments compared to St. Louis County and St. Louis City?
St. Louis County has taken a different approach. Many years ago, St. Louis County voters decided to make an investment in public health in St. Louis County, and we have a very robust and vibrant public health system. And we have made the decision to build out our vaccination network so that we can provide a steady amount of vaccines on a daily or near daily basis. The approach in some of the rural areas where they don't have this public health infrastructure is to use the National Guard for mass vaccination sites. And these will happen every few days or every few weeks as they're rotated around rural Missouri. And when a mass vaccination site offers 1,000 or 2,000 vaccinations a day, it certainly seems like a lot. But in St. Louis County, we're going to offer our vaccinations on a daily basis, and that allows us to scale up more quickly as more vaccine becomes available. But we'll be watching those numbers closely with the state, and we'll be working with our hospital partners to make sure St. Louis County and the St. Louis region is receiving the doses of vaccination that they should be receiving based on the population in our part of the state.
Finally, it looks like there's some clarification on the site in Ferguson. Will there be more distribution days at Flow Valley, and when is the next distribution event?
So the question is about the mass vaccination site that St. Louis County is operating at Florissant Valley Community College in Ferguson. And that site is going to run every day except for Tuesdays. It will run through the weekends. And we will be scheduling as many vaccinations there every day as we can get a vaccine from the state to do those vaccinations. So that mass vaccination site in St. Louis County, in North St. Louis County in Ferguson, is a site that will operate every day except for Tuesday.
That is all I have.
Okay, thank you.